everyone, it's your girl Anita, your favorite girl Anita. So today we're talking about HIV and AIDS. But before we delve into that topic, let's talk about the fact that we all know, or if you didn't know, you know now, that President Donald Trump has cut off funds to PEPFAR. This actually stemmed from the policy on foreign aid, which he instituted on his first day in office, instructing all US government agencies in charge of foreign assistance programs to suspend disbursement of funds, thus affecting PEPFAR. So PEPFAR is the President's Emergency Plan for AIDS Relief, which was initiated by President George Bush in 2003. And since its inception, the US government has invested over $100 billion in the HIV/AIDS response, saving over 20 million lives. With an annual budget of $6.5 million a year, PEPFAR has helped in delivering HIV treatment, which has helped save lives, curb the spread of the virus, and help countries achieve an epidemic control. Over 20 million individuals are actually dependent on this HIV treatment from PEPFAR. The goal of this treatment is to keep the level of the HIV virus in the blood low, and also to keep their CD4 cell count high. This helps the immune system to recover, to be able to fight over other infections, and the viral load is so low that they are unable to even transmit this virus to other individuals. So now, let's go into HIV and AIDS. So HIV stands for human immunodeficiency virus. When this virus enters the body, they target the CD4 T cells or the helper T cells. These are actually white blood cells that help in fighting off infections. So this HIV virus enters the body, they decrease the immunity of the individual and also increase the individual's susceptibility to having other infections. What are the symptoms of HIV? Symptoms of HIV range from flu-like symptoms like chills, cough, muscle aches, headache, running nose, and so on. And also symptoms like swelling of the lymph nodes, that's lymphadenopathy, oral thrush, weakness, night sweats, fatigue, and so much more. When laboratory investigations are done for people infected with virus, you see that their white blood cell count is low, their CD4 T cell count are actually low, go below 500. People infected with HIV actually have their CD4 count about 350, and normal CD4 cell count is supposed to be within 500 to 1,500 cells per cubic millimeter. Diagnostic tests that are done to check for this HIV, they do diagnostic tests like the ELISA test, and when positive, you have to actually confirm with the Western blot test. Individuals will confirm to have HIV. The other tests you need to do, like the antibody test, to check for antibodies that have been formed to fight against this virus. Do the antibody/antigen test. Do the RNA/DNA test to check for the viral load. Also do the complete blood count test, the urine test, also test for tuberculosis, pap smear to check for cervical cancer, and so much more. What are the risk factors for this HIV? What are the things that can predispose an individual to contracting this HIV? There are a whole lot, but we're looking at some like having unprotected sex, having unprotected sex with an individual that's been infected with HIV, having multiple sexual partners, IV drug users, also from mother to child, either during delivery via the placenta, during breastfeeding via breast milk. Also, people like health workers are also at greater risk for contracting this HIV, probably due through needle pricks, contact with infected blood, and also infected bodily fluids. Also, infection from blood products. If an individual has been transfused with an HIV-infected blood, that can predispose an individual to contracting this HIV. Blood tests are also done to ensure that the viral level is low or suppressed, because the goal of this treatment is to keep the viral levels so low that even the test cannot detect it. We call that an undetectable viral load, making it hard for this individual to transmit this virus to other individuals. When HIV is left untreated, the CD4 cell count can go below 200, and when it goes below 200, this individual is said to have AIDS. That's the acquired immunodeficiency syndrome. That's a complication of HIV. And when the individual has AIDS, the individual is also predisposed to greater varieties of symptoms, and also predisposed to other infections like recurrent bacterial infection, pneumocystis, pneumonia, tuberculosis, candidiasis of the airway, and even cancer. Drugs that are used for patients with human immunodeficiency virus, the drugs that are used to curb this virus, are called the antiretroviral drugs. It's not just one drug, it's more like a combination of medications, a drug regimen that helps individuals with this virus live longer and healthier lives, improving their life expectancy to near normal levels, reducing the risks of transmission to other individuals, because the goal of this treatment is to keep the individual's viral load low, to make sure that the level of this virus in the blood is so low that it is undetectable, reducing the risk of transmission, keeping the CD4 count level high. So these drugs would actually help in improving the immune system, helping the immune system to fight over infections. And when the immune system is recovering or is well recovered to be able to fight infections, the complications of HIV would even in turn disappear. Also, it also helps to slow down HIV replication. Method of prevention. Number one, get tested. Know your HIV status. Individuals that are infected with this HIV that do not know and look healthy, those are the people that are even at greater risk for transmitting this virus. Avoid illegal drugs and sharing needles with other people. Avoid coming in contact with people's blood or bodily fluids, especially we health workers. When taking care of injured people, you want to make sure you keep yourself safe. Use personal protective equipment like your gloves, your shield, or whatever you will need to use at that particular time, your gowns, whatever, to keep yourself protected. And if you know that you have HIV virus, do not donate blood, sperm, or any other bodily fluids. Do not donate them. Instead, go seek for help so that you can be started on the antiretroviral therapy. So, what are the patient teaching? You want to teach your patient as a health worker about things like safe sex practices. Tell them about the importance of regular monitoring of their CD4 cell count, because we want to make sure that the viral loads are suppressed, reducing the risk of transmission to other individuals. Also, teach them about PrEP, that's pre-exposure prophylaxis, for uninfected sexual partners, or just for individuals that are not infected but at greater risk of contracting this virus. Also, tell them about avoiding infection, like avoiding crowds, avoiding sick people, avoiding changing their cat litter boxes, and just performing personal hygiene in general. Individuals with this virus are supposed to take their medications daily. When they go get supply of these antiretroviral drugs, they get a supply of about 3 to 6 months. Drugs actually help to keep the viral load levels low and the CD4 cells count high, as we've discussed earlier. So these medications are not taken daily as they should be taken. You see that the patient's viral load will go really high and the CD4 count levels will drop, increasing the risk of transmission and making the individual more immunodeficient, because these drugs are supposed to help the immune system recover and fight over infections, and the individual will be susceptible to AIDS and other infections. The individual could even die from the complications of other infections and also AIDS. So when these drugs are not taken as they should be, it could cause mutations to this virus, making it more virulent, so resistant to medications that were previously effective at keeping it in check. So you want these patients with this virus to take their medications daily, because these medications will help to reduce their viral load, improve their CD4 cell counts, make their viral loads undetectable, reducing the risks of transmission. If you ever feel or believe or suspect that you've come in contact with HIV, please seek medical attention right away. So thank you for staying to the end. Please do not forget to leave your comments in the comment section. Let me know what you think about this video. I'll do it to reply every comment. Subscribe and hit that notification bell so you get notified every time your girl drops a new video. So till me again, bye bye.